Welcome to our webinar today. We're talking US export opportunities and tariffs insights, a really hot topic right now. Today is presented by the Medical Technology Association of Australia, MedTech Compass, and our guest, Department of Foreign Affairs and Trade, Austrade, Registrar Corp, and Planet Innovation. It's lovely to meet everybody. My name is Tennille Murray, and I am the Innovation and Growth Lead at MedTech Compass. MedTech Compass is MTAA's new membership initiative for startup and early stage companies designed to connect innovators to the right resources, capability, and advocacy to help them scale and commercialize. Before we begin, I'd like to acknowledge the traditional custodians of the lands on which we meet today, the Eora Nation, and pay my respects to elders past, present, and emerging. I'd also like to acknowledge any Aboriginal and Torres Strait Islander people joining us online today. That's better. Now everyone can see me better and say hello. So for many years, the US has been the first major export destination for Australian medtech innovators. It's a market that's vast in size, sophisticated in regulatory standards, and the US-Australia Free Trade Agreements has supported that pathway for over 2 decades, reducing tariffs, improving procurement transparency, and fostering regulatory alignment between the FDA and the TGA. The landscape, as we all know, has shifted. We are now facing a new US tariffs regime and significant regulatory changes at the FDA, creating fresh challenges but also opportunities for Australian companies. Some tariffs could jump as high as 25 to 40% if agreements aren't reached, and these pressures particularly impact small and medium-sized enterprises. Today's session, we are hoping to unpack what these changes mean in real time and to explore the practical strategies for navigating them from a market entry and regulatory perspective to manufacturing validation and alternate access pathways. I might just share my screen again so you can see our wonderful list of speakers we have coming up. There we go. We have 4 incredible speakers who we are very grateful have joined us this morning, and especially because they're coming to us, some of them from the US, so thank you for taking your evenings and joining us for this important webinar. Just a little bit of housekeeping. After the presenters speak, we will have a Q&A. If you have any questions, you're welcome to pop them into the chat function and we can ask after the presentations, or we encourage you to unmic and we can see your lovely faces. All the questions will be done after the 4 presenters have spoken. All right, to kick off, we're going to hear from Tara Booth, the Deputy Lead of the US Trade Task Force in the Department of Foreign Affairs and Trade. Tara is an international trade lawyer, negotiator, and diplomat with deep World Trade Organization and free trade agreement experience. She's been at the forefront of Australia's engagement on the US tariff developments. We thank you again to all our speakers and participants for joining us, and please join me in welcoming our first speaker, Tara.
Thanks very much, Tennille, and thank you to the host of the Medical Technology Association of Australia for inviting me to participate in this panel. I'm here to give a bit of a flavour or a snapshot of where we're sitting now in terms of the series of trade measures, including tariff measures that are being applied by the US over this year. Since the inauguration of President Trump earlier this year, we've seen a huge number of trade announcements, including a lot of tariff measures that have come through. I think I recall seeing some media suggesting there were over 200 tariff measures we've seen in this year alone. And those are affecting, we know, Australian business and creating significant uncertainty for Australians trying to do business in the US. So I thought we'd take a step back and do a bit of a snapshot of what the situation is now, particularly with focus on tariffs and how we got here. You'll recall on the 2nd of April this year, President Trump announced a series of country-specific tariff rates that would apply to a large list of countries. You probably saw the boards that were shown and around the media at the time. The remaining countries, including Australia, were issued a tariff rate of 10%, which is what has been colloquially called the baseline tariff rate, given it's the lowest reciprocal tariff rate applied to countries. Subsequently, those country-specific rates above the 10% baseline were paused or suspended for a period of time. That was extended and expired on 1 August this year. In practical terms, it meant during that intervening period, all countries, including those with those higher level country-specific tariffs, were essentially operating with a 10% tariff rate for their goods exported into the US. And during that period, of course, we saw a series of countries discussing with the US with a view to reaching negotiated outcomes that might lower those rates before the end of the pause. And so we saw a number of announcements, including with some of our biggest trading partners, including Japan, the EU, the UK, some in our region, Philippines, Indonesia, Republic of Korea. We've been looking very carefully at the content of those announcements. Really what we're seeing at the moment are very little details and really just frameworks for further negotiations. We will continue to monitor those outcomes very closely as those details emerge, and we'll particularly look to assess what those potential impacts might be for Australia, including with respect to our relative competitive advantage in some specific key markets. But where are we now? So we know that that pause was due to expire on the 1st of August. The day prior, there was another executive order issued in the United States, which implemented a new revised tariff protocol for all countries. Now, that listed country-specific tariff rates for 69 individual countries. Now, that included implementation of some of those negotiated or announced outcomes of deals with countries for revised tariff rates. It also included a large number of other countries that had adjusted tariff rates, some going up, some going down from that April 2 announcement. The remainder, and that continues to include Australia, continue to have this 10% baseline applied. All of those new revised tariff arrangements came into force from 8th of August this year, so they are currently in force. Now, from the perspective of the Australian government, we remain disappointed that that 10% tariff rate continues to apply to us. So we continue to engage with the US administration at all levels and advocate for the US to apply our existing obligations and rights under the US-Australia Free Trade Agreement. Our view is under that agreement, we should enjoy tariff-free access to the United States market in the same way that US goods enjoy tariff-free access to the Australian market. But let's put that into perspective. The US is an important trading partner for Australia, but we are not as exposed as some countries. So currently our exports into the US represent only 5% of Australia's global exports. We also recognise no country has a low reciprocal tariff rate currently being applied, and that includes those countries that have negotiated separate deals with the US. But we do understand that the US trade measures are complex. The environment we operate in is rapidly evolving, and that creates significant ambiguity and uncertainty for industry. So far, looking particularly at your industry, the main US measure or tariff measure affecting Australian exports of US devices to the US is this 10% reciprocal tariff rate. We also understand that some products continue to enter the US tariff-free under the Nairobi Protocol and consistent with existing tariff exemptions. Now, separately to the reciprocal tariff rate, there are some sector-specific tariffs that are being applied. You may have already seen them, that they apply higher rates, for example, steel and aluminium and copper in certain sectors. Now, those are the result of ongoing what are called Section 232 investigations that relate to investigations into the national security implication of certain exports. There is an investigation ongoing on pharmaceutical products in the US that we expect will have an outcome that could involve the application of tariffs to those products. Our assessment is those potential measures will not directly impact the medical devices exports, but it's something we are watching very closely as the scope and application of the outcome of that investigation becomes clearer. Now, of course, we understand that there's direct impacts, but there's also indirect impacts on your industry. And the uncertainty and the financial market volatility is starting to impact investment and research funding decisions, and I expect that would be the case with your industry as well. Now, in the face of this uncertainty, we're continuing to work to expand a network of FTAs in order to access new certain markets for our exporters. We have a free trade agreement with the UAE that's come into force. We're continuing our negotiations with India and the EU with the hope of finalising FTA agreements with them. We have the Southeast Asia Investment Deal Team across the region, which is facilitating Australian investment in commercial projects. We're upgrading our ASEAN, New Zealand, Australia FTA, and we're boosting membership of the CPTPP, or the Comprehensive Progressive Agreement for Trans-Pacific Partnerships, which is a super catchy title. So I'll leave it there. I know that we have colleagues from Austrade who are going to be able to provide more insight into the more practical support and assistance that the government can provide exporters in the meantime. But I would welcome any questions, but also welcome any insights in the impact of the US tariffs in particular are having on your industry. And as I said, look forward to answering other questions. Thank you.
Thank you very much, Tara. I'll remind everyone, if you'd like to turn your videos on, we would love to see you this morning. Next up, we have Gabrielle Hall, Australia's Consul General and Trade and Investment Commissioner to Houston, Texas. Gabrielle brings frontline insights into the US health sector, foreign investment trends, and the realities of trade across the southern states. Please welcome Gabrielle Hall.
Brilliant. G'day, y'all. The official greeting from Australia in Texas. Good morning, good evening. So great to join you all this afternoon, this morning. And congrats to the MTAA for convening this very important and timely conversation on what is happening in the sector. I'm really delighted to be joined as well by two of my Austrade colleagues who are on the call. I've got Stephanie Clark, who's our Business Development Director for Health. She's based here in Houston with me. She is our subject matter expert on all things health, medtech, med device, biotech, you name it. And we also have Munish Sharma, I spotted, the Senior Global Engagement Manager for Health based in Australia, who is on the call too. He might be on camera, he might be waving, I can't see you, and also works with not just the US, but health sector, health exporters globally. So with that, I just wanted to really sort of build on what Tara was saying and land this conversation on some more practical kind of commercial advice. 4 key areas to cover off on today for Austrade. So the state of play in the health sector, ways to think about the situation with a commercial mindset, some practical tips, and then how you can work with us to overcome some of these challenges. So I think at the moment the name of the game is uncertainty. You know, the saying here is the only certainty is uncertainty. And so I think the companies we're talking to are just sort of taking it in their stride and doing what they can do and what they can control, given that so much actually is out of control for people at the moment. So not only the tariffs, but the broader funding cuts to the health sector, and what that means from a loss of government funding into key hospitals and health institutions, as well as some of the jobs losses that has been occurring over here, is certainly unfavourable for the sector at the moment. Additionally, I wanted to touch on the headlines around the diversity, equity and inclusion funding as well. A lot of that is impacting on the health sector and some of the research that's being done around certain demographics. So that's certainly the case. The impact on regulation. I know we have a speaker that'll talk to regulation and funding impacts on the regulatory impacts, and then what it means for your customers in market and who's paying for your technology and your devices, and the impact on the consumer as well. On the jobs losses, there is a silver lining for Australia at the moment, because Australia has very proactively introduced what we are calling a national innovation visa. And what that is targeted towards highly skilled sort of American health professionals as one demographic within a suite of potential skill sets and scientific researchers, etc., that might consider availing themselves of the opportunity to come to Australia to continue their research or bring their talent, bring their IP, and that's absolutely a pathway that the Australian government has recently introduced. So if you have colleagues in the US that you think might be interested, that's something I encourage you to look at. Once I'm finished talking, I'll find the link and I'll pop it in the chat so people can have a look themselves. So it's uncertain. The landscape is not looking good at the moment. Let's call out the elephant in the room. However, I'm here to reassure you all that Australia remains a very deeply trusted partner for the US. And this market here is far too big to ignore from a commercial perspective. The US remains one of the biggest markets in the world for most sectors, health particularly. And we've been through this scenario before where we've been maybe disadvantaged or locked out of certain markets. And absolutely, as an exporting company, you need to think about your diversification strategy, and then how do you spread your risk over multiple markets. Certainly, Austrade has been standing up programs and supports in other markets to be able to help exporters do that. Equally, the message that Austrade would like to convey is that we think you need to double down on your relationships, protect the market share that you currently have, really foster and nurture the relationships that you have in this market, because if you withdraw now, it's going to be sort of more difficult to build that back once things sort of stabilize in any way. So we are really working hard to support our exporters to really protect what they have built and grow within what they in the domain that they're specializing in. MedTech, of course, and med device, of course, is one of the more impacted areas, particularly given the hardware componentry, supply chain complexity, and not just sort of where the Australia tariff comes into play, because from companies we've spoken to, you know, we have highly sophisticated value-added products, 10% and a very disadvantaged exchange rate. 10% is absorbable. 10% can be shareable with your US partners. It's where the third markets, or as Tara talked about, those special kind of componentry from a materials perspective where the costs tend to add up. So think about your supply chain. And we're doing a lot of work at the moment with medtech companies coming into the US, looking at local contract manufacturers or manufacturing partners to try to sort of onshore or locally shore some of their manufacturing to avoid any kind of export or sort of import requirement for their good. So something to consider is your supply chain, where you're manufacturing and who you're sourcing from. So from a practical tips and tricks perspective, I think, like the US anyway, it's a pay-to-play market. So you need to be prepared to spend money. You'll need a strong runway of capital and dedicated full-time employees on the ground in the market to make your market entry work. Distributors really aren't a good indicator of market commitment. So you need to kind of put some boots on the ground. We encourage you to find the right partners. So use the referral networks, use those experts, particularly when it comes to US-based lawyers that really know what's happening here on the ground, as well as your FDA advisors as well. Come to market with a strategy. So know the market. Think about the US as 50 separate countries, essentially 50 separate states with their own regulation and flavor. So really do your research on that. Know your customer. Who are you selling to? Where's your demographic? And also know your competition. So if you have competition, how you have competition, even if your exact solution doesn't currently exist. So how is a problem that you're solving currently being handled in the market? So know your market, know your customer, and know your competition. And then I think the other sort of couple of key tips would be around articulating the value to the market. So understanding your the mechanics of the US healthcare system and who pays for what and who pays for your solution. And particularly if you can demonstrate where you can create efficiency, increase revenue, or save money, that tends to be a winner over here as well. So I think I'm just going to talk now about how you can work with Austrade. So we have a number of sort of programs and opportunities to engage. I think the big one that will be spoken about a few times on this call is the upcoming AdvaMed 2025, which is the MedTech conference in the first week of October in San Diego. My wonderful colleague Steph Clark will be there in October as well. And as well as there's a number of state and territory government trade and investment agencies that have a physical presence here in the USA that are really proactive on health in the healthcare space, and they will be involved as well. So you work with Austrade, work with the peak body, work with your local state or territory agency. Everyone will be there to support you. And the last comment I'll make before I ask Steph if there's anything very obvious that I have missed from her perspective is the landing pad program. So Austrade has a flagship landing pad program in San Francisco. We run virtual and in-person cohorts throughout the year. It helps Australian tech exporters learn about the US market, develop or refine a go-to-market strategy, and so several stages depending on the stage of company that you're representing or trying to build. The recent cohort, I think, closed and is about to come underway this month and next month, but please keep your eye out for any sort of future cohorts and rounds if that might be a softer way to start considering the US market if that's the stage that your business is at. Yeah, I might just leave it there, take a pause, take a breath, and look at Steph if there's anything I've missed. Otherwise, Steph will be around for the Q&A too, so I would encourage some really great questions. If you have any more specific sort of sectoral questions, then we'll be equipped to support that.
Fantastic.
Yeah, I have nothing to... Good.
Oh, no, go Steph. Nothing to add.
I was
That's
going to say, I don't have anything to add. Great job.
Brilliant. Okay, Paul, thank you. All right, over to you.
Thank you so much, Gabrielle. And speaking of the Q&A, you can type your questions if you have anything pressing for Gabrielle or Tara in the Q&A box. You can find that at the top of your screen, or you can click the raise hand button, and in the Q&A section, we'll come back to you. Our next guest is Cornelia Rooks, the Senior Regulatory Specialist at Registrar Corp. Cornelia spent over 2 decades with the US FDA, reviewing, approving devices across multiple divisions, and she now helps companies navigate complex US regulatory pathways. Please welcome Cornelia. Cornelia, if you just want to unmute, please.
Sorry?
There we go. Hi, good morning.
Good morning. Well, it's afternoon here. It's actually evening. I wanted to thank everyone for the invitation to come to talk about regulatory affairs in the US. And we've heard a lot about what is currently going on with the new administration. And so I wanted to walk through some of this, may be a bit elementary, but I think we need to walk through what's required in order to market a product in the US. And we're going to then go into what a medical device is. And so the definition is pretty straightforward, but I think a lot of people don't realize how this really impacts how the product would be regulated within FDA. This is a little about our company, and we're here to help answer any questions you might have about FDA and the regulatory requirements. So in the U.S., medical devices are intended to for use in the diagnosis of disease, cure, mitigate, treat, prevent disease. The most important take home from this definition is that medical devices have a physical effect and not a chemical effect. And you have to look at whether the device is actually performing as a medical device. And so a lot of times companies get totally confused as to whether this is a physical action or a chemical action. And so you need to be sure that that is what is achieving the primary intended use of the product. And all of that is not dependent on the product being metabolized at all. And so this is the most important piece within the medical arena to determine whether this would be regulated as a drug or objects or a device. So you have to consider the actual. Are you still seeing this? Hello?
Yes, looks good.
Okay. All righty. So in order to do that, we have to take how the device will be regulated in the US. And so generally it goes from a class 1 to a class 3. So class 1 actually lower risk. These are generally, most of class 1 devices are exempt from any pre-market review by FDA at all. A small number of those class 1 devices are in fact under pre-market notification, which would require a review by FDA. Consider what class the device is falling into. If it is a class 2 device, this device has a moderate risk. Most class devices are actually subject to 510K or pre-market notifications, but a small number of those are exempt from pre-market notification. And in this particular case, the company has to show that their device is as safe and effective as a predicate device. And this would be a device that's legally marketed in the US. Determine that a device is legally marketed as a class 2 device, you must be able to determine that, one, it has a 510K clearance for that device. And you're able to determine that by going into FDA's database and checking to see if, in fact, they do have a clearance. The hardest part here is for some companies, is trying to find a predicate device. And a predicate device, once you have determined what that predicate device is, then you should be able to submit K application to FDA. And I've included here the user fees for fiscal year 26. And you'll notice that there is also a small business exemption for those types of devices. And it's, I sort of lost the screen. Oh, you're still on that one. Okay, can you, oh, wow, let's see what happened here. We're moving, okay, there. So here's the table for the user fees for the 510Ks. I'm sorry about that. Okay, and so this is how FDA actually gets some funding to do the 510K reviews. Any of the applications that they have to review, they have now through GDUFA actually been they can use the funds that they get from the user fees for these applications and to review the applications. The class 3 devices, on the other hand, are those devices that are not within a type marketed before the date of 1976 medical device amendments. That's when the first amendments were established, refer to pre-amendments devices. So there are some devices on the market that are pre-amendments, but then if they were not on the market before then and they're not classified as class 1, 2, or 2, then are automatically classified into a class 3. And in this particular case, the company would have to do clinical trials in order to determine that the product is safe and effective. So in the class 2, you have to show that your product is as safe and effective as a predicate device, but in a class 3, you have to prove that your product is safe and effective. And user fees for PMAs now, pre-market approval applications, have increased substantially. And there is also a small business fee associated with those particular applications as well. So there are other pre-market pathways. So if you cannot determine your product is class 1, class 2, or class 3 device, and it is a moderate or low risk medical device, it's not a high risk device as the class 3s, then you could then submit what's called a de novo classification application to FDA to review. And then they would put it into a class 2. So, and once they give the go-ahead to down classify the device from a class 3 to class 2, they would then issue a letter saying that you are now able to market your product, and your product then will become a predicate device for any other products that come on into the market after that. Then there's a humanitarian device exemption, and these are for applications for those humanitarian use device products. And that's some medical device intended to benefit patients in the treatment and diagnosis of conditions that may affect not more than 80,000 people. So you can come in with an HDE. I'm sorry, we went back one. Oops, we went way ahead. Okay, we want to skip. Yeah, and so with the HDEs, you will be able to submit and get an approval for those as well. Investigational device exemptions are used when you need to do clinical trials. So they would be used for class 3 devices in particular. Some class 2 devices do have IDEs associated with them where a company needs to have clinical data for them. And so all clinical evaluations of investigational devices, unless they are exempt, must have an approved IDE before the study can be initiated. So once you have now determined all of these things, you've determined what the classification of your device is, you've determined whether you have a class 1, class 2, class 3 device, you have gotten appropriate clearances, you get a 510K clearance letter from FDA telling you that you're found to be substantially equivalent to a legally marketed predicate device, and you are now cleared to market your device. So 510K products are not approved, but they're cleared. And PMA products are class 3 by FDA. Once you get that particular clearance or approval in hand, or if the product is a class 1 or 2 exempt product, you can go forward with registration and listing. And these are register and list. And every company every establishment that is involved in the production, distribution of medical devices intended for the commercial distribution in the U.S., including those that are imported for export, are required to register annually with the FDA. And most establishments that are required to register are also required to list the devices and activities performed. And so once you have determined that you are in fact a medical device establishment, you must then register and you must list if you're performing a product. So briefly, we've heard about the tariffs, and so I just wanted to cover basically I'm sorry again, I keep going to the wrong one. We want to cover the laws in the U.S., which all of these tariffs. So as we've heard, the tariffs are actually taxes that are going to be imposed on imported goods by the government. So these are products that come in. The importer now is responsible for these tariffs. And we all believe that the tariffs will eventually be passed on to the U.S. consumer. And so while these taxes are legally paid by the importer of record, usually the importing company, the economic burden is often passed on to the consumers, as I said. So the section, this gets into two tariffs. Basically grants the president the power to restrict imports of goods that threaten U.S. national security. So a lot of these tariffs were under this provision. And most recently, this was enacted in 2018 before it was enacted again here in 2025. Which we all have heard already about which industries would be impacted. As far as the copper is concerned, the copper would include products that even contain copper. So it's not clear whether or how this about the copper containing products. So we know that certain medical devices have copper, but how be all the or less will be subject to specific tariffs. And as it has been stated, the 10% in general has been Australian imports. So that's really brief. And so while the FDA hasn't formally revised its review targets yet, recent data has suggested that there is really a slowdown happening already with those medical device approvals and clearances I spoke about earlier. And it also has impacted some of the pre-market submissions that happened, the meetings that occur prior to submission of pre-market applications impacted some of the advisory panel meetings. So what's been happening, of course, with the reduction in force of the federal and government employees has really caused this slowdown. And so we know that as the applications are rising, view them is being reduced. And as we speak, there are still in place. And so the recent layoffs may have a very devastating effect on companies that produce medical products. And we've seen some of this more recently with drugs, that eventually the changes will start to impact medical devices somewhat. And so we advise companies to be proactive about their planning and plan for potential delays. Those days that are mandated, for example, the 90 days for a response back from a 510K or the 180 days in the PMA, all the numbers that are in place may not be met. And so they may be extended. And so it may go from a 90-day 510K to a year out or more. So companies should plan for that. And that staffing and resource constraints may be contributing to the slowdowns within FDA and uncertain pre-market review processes. Companies should be very mindful of these challenges and consider a potential impact on the product development and market entry timelines. And if you need any help trying to get through any of these requirements, feel free to give us a call. We may be able to help you better understand what's going on within the FDA. Thank you for your time, and I'm looking forward to any questions.
Excellent. Thank you very much, Cornelia. Our final guest this morning is Stuart Elliott, the co-founder and executive director of Planet Innovation. Stuart has guided multiple devices from concept through US manufacturing and approval. Stuart, we really look forward to your insights this morning. Please welcome Stuart.
Good morning, everyone, and thank you very much for the opportunity. I'm hoping you can see my presentation.
Yeah,
so
looks good.
I wanted to do a very brief introduction on Planet Innovation for those who don't know us. We're a Melbourne-based company. We have operations in Melbourne and the US. We've been operating for about 16 years, and we do medical device design manufacture. So just that's about as much as I was going to do, but we're very involved in I guess global manufacturing. The tariffs are front and center of our business, along with a whole lot of other factors. And we do, devices ranging from handheld medical devices through to, some of them FDA regulated, some of them life science, but some through to large, floor standing instruments. As I think Gabrielle said, the US is a really key market for everyone, I'm sure, and for us, it's around 80% of our customer base. So it's absolutely not something that we can ignore. I'm just going to flash through a couple of slides showing the sorts of things to do. This is our manufacturing, and it actually looks identical in Melbourne. And we have a facility in Irvine. It's the really final assembly and test of products. This time-lapse shot is actually shot during the pandemic when we were very busy building diagnostic devices, and a couple more shots just to give people a feel for what it looks like, including clean room manufacturing. This particular shot is in our Box Hill facility. But what I wanted to do was just, enough of the introduction, is share some insights into what we've been doing as a business in managing global supply chain. And so this is, I guess, an overview of our business. I want to share some insights from that and how it might apply to you. We have manufacturing. We started our business 16 years ago in Melbourne as an innovation service provider. We do manufacturing in Melbourne. We set up in 2021 in the US, in California, doing manufacturing, so well before the tariffs. And what I wanted to say is there's a whole lot of reasons why you need flexibility in supply chain. We recognised that probably about 8 years ago, that just having manufacturing in Australia wasn't meeting the needs of our customers, nothing to do with tariffs. There's a whole lot of factors, and I'll talk to those shortly. And so we set up manufacturing in the US to provide flexibility to our customers. And then, more recently, as our businesses evolved, as our customers evolved, as our businesses grown, we've realised we need even more flexibility, a global supply chain, arrangement. And so we've formed a strategic partnership with a Singapore-based at-scale manufacturer called Mayban. And so what that does, and what I'm really recommending to people in this environment of tariffs, just adds one more variable as why you need to consider a global, flexible supply chain. And so, just giving some anecdotes then on that. We have products where there are different solutions for different products. So some products have a very large amount of embedded labour, for example. There's a lot of labour content to put a product together, and it may not make sense to do that product in a high labour cost region. Other products and sometimes you can achieve this through design, you can put a lot of design effort in, really reduce the number of parts, get the labour content down so the products are, assembled in a very short amount of time. And then in that situation, you can actually very easily, very cost effectively put manufacturing in a relatively high cost environment like California. So labour rate is a variable. The number of hours or minutes going into assembling a product are a key variable. Design maturity, proximity to customers, access to the quality systems you need, particular ISO 13485. Freight costs are an important variable. So all of these things are things that we were thinking about well before tariffs. If you're building just in time and you've got a floor standing product that's quite heavy, but you're building just in time, so you're air freighting that product, then the freight cost can actually be a material percentage of the final product cost. And so you might think you're doing it cheaper offshore, but you might be better off doing it in the US. And so there are a number of variables. There's probably about a dozen more. A lot of our customers want dual sourcing. If you're doing a medical device, you may have a common scenario is to have an instrument and a consumable stream, like a diagnostic test. Our customers, or even our customers' customers, might insist on having a dual source supply chain for those, because we've learned, particularly during the pandemic, that having a single source for a consumable item that you need to keep running, say, a diagnostic product, is actually a really high-risk strategy. Having a dual source is critical. And so that's another variable that we're seeing some of our customers demand. We've added the overlay of tariffs on top of that. And I apologise if anyone wants the simple formula for success, but it actually is quite complex to look at where you should manufacture based on the complexity of the product, the physical weight of the product, the size of the product, the number of hours embedded in the product. We have somewhere we are moving manufacturing and final assembly in particular to the US. It is quite common, and one of the reasons I put up those photos is to show most medical device companies, including Planet Innovation, do manufacturing as final assembly and test in one facility. It's very rare to have full vertical integration, meaning you don't do, PCBs or injection molding or all those things in the same site. You tend to bring those components in from specialist suppliers. And so what we're seeing is clever allocation of sub-assemblies. So if you're not in medical devices, I'll describe it like this, which is, imagine you're doing final assembly of a car in the USA. You might be bringing in a fully assembled and test engine that comes in from either Australia or from Southeast Asia, putting that into the final product. And so you can, by managing your supply chain, whether it's bringing in components or sub-assemblies, you can minimize the tariffs if you do that cleverly. Interestingly, you have to be a little bit careful. There are country of origin rules around manufacture. So if you're bringing in a raw component and doing substantial change to it, like plastic pellets and then molding a plastic part, then that's a substantial change. And if you're the country where you're doing the molding, that might be, say Singapore, you would apply the Singapore tariff to that. But if you're bringing in, the Singapore tariff, and then you can ship it, say, to the US. If you're bringing in that raw component directly to the US from, say, China, you might end up paying a higher tariff, even though you're manufacturing in the US, because you're paying the tariff on the imported components. So there is a bit of complexity to work through, depending on the type of product and whether you're bringing in a sub-assembly that then goes through substantial transformation. There are some rules around that. They're quite complex to explain and too complex for this call because they are dependent on, the detail is in the free trade agreement, if there is one, between each country and the USA. So Australia and USA free trade agreement has some details around that substantial transformation. And so there are companies that are expert in that. There are companies like us that are doing it and that can help out. But we've really arrived at a solution where having, in our case, a triple sourcing strategy where we're doing a combination of components in some areas, sub-assemblies in some areas, and then final assembly in either Australia or the USA is working for us to minimise the cost impact for our US customers across all those variables, labour amount, labour cost, labour hours, freight costs, tariffs, and the benefits of just being close to the customer, which is actually most important when you're undergoing a lot of design changes related to design maturity. If you're changing the design a lot, it is very advantageous to be close to the customer. If the design's very mature, you can be sort of more arm's length. So there is no silver bullet, but I would encourage everyone to have a flexible, I guess, multi-regional supply chain strategy, and then you just dive into the details to look at how to make that work. I'm also just reiterating one of the other earlier comments was don't forget about non-US markets. So we have moved some of our manufacturing to California, but I would also reiterate that, it's really quite you've got to be a little bit careful. You don't want to be moving manufacturing to what is a slightly higher cost area, and then shipping product over the border to, say, Canada, where you could be importing that product directly from Australia or from somewhere else directly to Canada and avoiding the tariff altogether. So as you're putting together that multi-regional supply chain strategy, just be cognizant that the US, it is for most of us that most important market, but be cognizant not to forget about all the other markets. Happy to take any questions if anyone has any specifics they would like to cover.
Wonderful. Thank you very much, Stuart. We'll go to our Q&A. We've got a little bit of time left. To kick off the Q&A, I'll pass over to Stuart Anderson, please.
Thank you, Janelle. Thank you, Stuart, Cornelia, Tara and Gabrielle. We have some questions coming through that I might sort of raise and explore with you all. Firstly, Gabrielle, one that came through in general sort of comment in terms of the US borders and experience, is it still safe to travel to America?
Yes. So I think the first advice from the Australian government is when you are travelling anywhere in the world, go and refer to Smart Traveller for the latest advice that the government is giving on your travel, and make sure you're doing the right thing. Make sure you've got the right visa. Make sure you've got your itinerary planned. You know when you're leaving the country at the end of your stay, and just be prepared and answer questions accordingly. But I think the data suggests that what we are what we are hearing and seeing in the news is perhaps painting a picture of things that are happening here, but the data suggests that visa, like entry refusals and those sorts of stats, are the same as they have been in the last few years. So I just follow the travel advice and consult your travel agent too if you have one. Maybe they have some special tips and tricks from people that they've worked with. But please come visit us in the USA.
Don't believe the speculative media that it's out there. Next question is, I'm going to call out a question from Penny Flicker. That's looking more towards Cornelia's views, but Stuart, you might also have some thoughts on this. How long does it take usually for a small business determination to be approved by the FDA, and does it expire? When is the right time to apply for a small business determination when planning a de novo submission?
I can answer. Yeah, with the small business determination, it happens rather quickly. At least it did. You would probably get a response back within 30 to 60 days of submitting your application for the small business determination. As as far as when you should actually apply, you should do that as soon as possible, because you're going to have to gather up all of the documentation to show that you are in fact a small business. And then once you submit your pre-market submission, you then can have your small business determination at that time when you have to pay the user fee.
Penny, does that give you a response? Any further thoughts there?
No, I think that covers it for me. Thank you, Cornelia.
Fantastic. Now, I encourage other questions to come into the chat or for folks to put their hands up, as there's one more that I'm going to direct more towards Tara and perhaps Gabrielle, and that's the questions regarding the tariffs implementation and operation. When paused, do the reciprocal tariffs expire? Do the rates noted for the specific countries that we're aware of, are they the ones that will be applying, or do they need to be gazetted first by the US to apply? So what's the process of the tariffs working in terms of the paused reciprocals versus the longer terms that apply? For those countries where there are no new agreements, do the expiring paused tariff rates of 10% revert to the reciprocal parents, the higher ones announced in April? And what happens to some of the EU countries that are European countries that are not formally part of the EU? Do they get covered by the EU umbrella approach, or are they reverting to the reciprocal tariffs? So, a fairly intricate question there. Tara, Gabrielle, might you be able to give some perspectives, please?
Thanks, Stuart. I can jump in on that one. In terms of the paused reciprocal tariffs, yes, they do need to be formalised in order for new tariff rates to apply. So what we saw was, during the period of the pause, all countries had this baseline 10% that applied to them. In order for that rate to change, a new executive order would need to have been made. That executive order was made on the 31 July, which put into place specific tariffs that applied to 69 individual countries, which is where I get to the second question. So that 69 countries included those that have reached these announced so-called deals with the US that had specific tariff rates that they had negotiated. So it implemented those negotiated tariff rates. It also included specific tariff rates for a large number of other countries. Those rates sometimes were the same as those that had been announced in the 2 April announcement. Others were changed. So, for example, New Zealand had a 10% tariff rate in April 2. The announcement on the 31st of July upped their tariff rate to 15%. So there was an adjustment. Some went up, some went down as part of that process. And then there were other countries who, like Australia, that didn't get specific tariff rates and continued at the 10% rate subsequent to that announcement. So that executive order is in force. It is currently applying as of 8 August. In relation to the EU, Switzerland, Norway, Switzerland, Norway is not covered by the arrangement reached between the EU and the US. They have their own specified tariff rates that are part of the executive order that was made on the 31st of July. From memory, I think Norway has a 15% rate. I think Switzerland is substantially higher. I think at around, get this right, around 31%. So they have individualised rates that apply as a result of the 31 July executive order.
Tara, some detailed perspectives there. I'm sure the team or participants can reach out to you for further details if necessary through either their localised trade contacts. So I think that's it for the questions. Tennille.
Thank you, Stuart. So firstly, a huge thank you to all our panelists, Tara Booth from DFAT, Gabrielle Hall from Austrade, Cornelia Rooks from Registrar Corp, and Stuart Elliott from Planet Innovation. And a huge thank you to everyone who's joined us this morning to listen, learn, and be inspired. We've covered a lot of ground, from the changing US tariff landscapes to the impact on Australian exporters, shifts in FDA regulatory pathways, and the practical realities of market validation and manufacturing in the US. I hope you're leaving today's session with a clearer picture of the challenges ahead, as well as the opportunities and strategies and some new contacts to help navigate them. If you'd like to continue this conversation, or if you'd like to connect with any of our speakers, I encourage you to reach out to myself or Stuart Anderson. My email is tmurray, MURRAY, @mtaa.org.au. Stuart is sanderson @mtaa.org.au. And we will welcome any further questions or any contact. We will continue our global webinar series with upcoming sessions focused on Europe, Asia, Latin America, and the Middle East to provide you with tailored insights and opportunities for Australian medtech companies in these markets. On behalf of the Medical Technology Association of Australia, MedTech Compass, and all our guests, we thank you so much for joining us, and we look forward to seeing you at our next session.
Thank you.
Thank you all.